Sure. So I'm recording this session. Folks who are listening to this now and in the future, we do not have quorum of at least 2 health commissioners for this meeting today. So instead, Commissioner Chow will graciously hold an information session and go through all of the contract items and discuss them so that he can make a recommendation to the full commission at the February 6th meeting to approve or not approve those items. So we'll go through each item as we normally would, except for the minutes. There will be no action during the meeting because we don't have quorum, and that's necessary in order for the commissioners to take action. Commissioner Chow, we can move on since we're not doing the minutes. Actually, I'll still do the land acknowledgement, even though it says not a official meeting, because we want to respect the process.
Sure.
The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to the first item to discuss today, which would be the monthly contracts report.
Okay, good. Thank you.
Hi, Commissioner Chow.
Yes.
We have
Good
12
afternoon.
items on the, good afternoon. We have 12 items on the report this month. The first item is for PHFE doing business as Haluna Health. Requested action is approval of a contract amendment to increase the total contract amount with contingency to an amount of $4,253,638 and to extend the current contract term from 4/1/2019 to 3/31/24, currently at 5 years, to a new end date of 3/31/27, extending it for 3 years for a total of 8 years. Haluna Health will continue to provide program administration and management services for DPH Population Health Division, the Center for Learning and Innovation, or CLI. Of the proposed annual funding in the amount of $743,571, Haluna Health receives an 8% administration fee of $55,079, with the remaining balance of $688,492 going towards programmatic cost. Sorry for that feedback. The proposed new agreement exercises the authority under RFQ 36/2017.
So whoever might be listening in, please silence your computer. If you're not speaking, then I'm going to mute you because there's feedback on our end. But please, if you're listening, turn down your computer if you have to speak. Thank you, Dean. Please continue.
No worries. Reason for the funding change: the department is requesting approval of the amount of $4,053,638, an increase of $1,654,749 due to the following 4 changes. First, one-time additional federal CDC carry forward of $205,302 for fiscal year 23-24, additional CDC funding in the amount of $57,000 also for fiscal year 23-24, additional federal CDC funding in fiscal year 24-25 and 26-27 in the amount of $1,500,000 or $500,000 annually for each of those 3 years, and 4, a decrease in the amount of $107,553 to the 12% contingency value applied. The current contingency amount is $269,228. Previously, it was $376,781. If you have any programmatic questions, Frank Sitters, the manager of Capacity Building Assistance Program, is attending virtually and can answer any questions you may have.
Thank you. The CDC money, because you're saying there's an annual difference of $262,000, and I could see that in fiscal year 23-24, you do have a federal CDC carry forward funding and then an additional amount from the federal CDC. But will that continue over the following additional years?
The carry forward won't continue for the additional years.
Okay, so So that annual amount of the 743 or the increase of 262 is only actually for the first year, is it not? I mean, for uh, 24, 25. Oh, no, I guess it's for 23, 24.
Yeah, it's for this current year. It's just been been a long process that to get the paperwork done and making sure everything's accurate. So there's been a lot of revisions, and we started back in September, so now we're here. We're finally submitted the contract and contract amendment, and are also working on getting these carry forward funds, so that way we can use them for the current fiscal year.
Okay, and it would appear that there is an additional federal money of 500,000 annually, right? So,
Yeah, yeah.
okay, well, I will assume that with that the amount that Helena Health receives 55,000. Oh, I guess that's an annual amount, right? Okay. Right, because that really is low for, I mean, sounds low, but oh, it's only an 8% administrative fee, so that's very good. Okay. Um, I don't have any other questions on this one, so we go on to the next one, please.
Will do. Item number 2 is with Bayview Hunters Point Foundation, requested action on the approval of a contract amendment to increase total contract amount with contingency by $7,798,709 to a new total amount of $24,098,709 to extend the current contract term, which is currently for 6 years from July 1, 2018 through June 30th of 2024, to extend it an additional 2 years to now end June 30th of 2026. The purpose of this amendment is to allow Bayview Hunters Point Foundation to continue to provide.
Do you want me to leave it on speaker?
Yes, please.
All right, please don't speak unless you're spoken to, so you don't interrupt the person who's actually presenting. Thank you.
Thanks, Mark. The purpose of the amendment is to allow Bayview Hunters Point Foundation to continue to provide mental health services for the DPH behavioral health services in the community. The requested amendment is to add additional funding to extend the existing contract services. We have Jessica Brown, Director of the Office of Justice, Equity, Diversity, and Inclusion, and the Mental Health Services Act to respond to any questions you may have. She's also able to respond to the questions submitted earlier by Commissioner Chow regarding the score of the BOCC monitoring report, that it was a score of number 2, improvement needed or below standard. And since this is extending the contract for 2 more years, he was asking how are the planned corrective actions regarding performance of services? We have Jessica here. I did want to summarize for the plan of action from the BOCC monitoring report. There were 3 specific things. 1, regarding 1 performance objective, that 100% of the clients must be offered an appointment within 10 business days of the initial request of services. 2, plan of action required for the program to describe how it is monitoring and increasing productivity for the current fiscal year. And 3, regarding trainings, the program to submit a plan of action to ensure that all trainings are taken by staff as required. As of today, the provider has not yet responded to the plan of action in writing, but we do have the Director of Justice, Equity, Diversity, and Inclusion, Jessica Brown, to respond further and answer any other questions you may have. Thank you.
So thank you. The question I would have at this point then is, and thank you for pointing out the corrective action plans and how Bayview is responding to those. But there is an annual difference now of 365,000 for the coming 2 years at least. So what does that actually provide for us in terms of more types of services? I mean, are we expecting to have more, more units of service or more people being served, or?
Yeah, I think more units of services, as you know, with our population-focused programs, especially during COVID, we saw an increase in the services that they were providing for communities. And so Bayview Hunters Point being that they're serving communities that were vulnerable during the pandemic, they've realized that they've increased their service in their service units. And so that's why we're asking for the amendment. Typically, even though I know that they're on a plan of action of correction, we've had phenomenal relationships with them. They've done phenomenal work, including having 100% of their clients have a treatment plan. Again, being able to provide services to their clients basically during the pandemic, and also to having 100% of their clients complete an updated CANS assessment and avatar as well. So this is the reason why there needs to be an amendment to their contract to allow for additional funding to serve the increased needs.
Okay, no, and so under your units of services that you have, is there a way of, I mean, I see all the target populations and the programs, but could you just define what 1, 2, 3, 4, and 5 are?
As far as the populations?
Well, no, it says under units of service, you have a CRDC, you have a number of things, and then you have CRDC 2, and then 2 items, and then 3 has 4 items, and I'm not sure what CRDC meant.
You're not sure about the terminology of the CRDC?
Yes.
Can you specify? Sorry.
CRDC's for the cost reporting, and he's wanting to know what these 5 specific different points.
Oh, I see. Okay. And so for their services are outpatient services, outpatient medication support, outpatient crisis, and then also to crisis intervention and case management. So you wanted more of a clear definition about what they provided under those service categories?
Oh, I see. Okay, so there are the types of things being done there, and then like 4 is administration. Okay.
Right.
Okay.
Right,
No,
right.
that's fine.
Okay.
Thank you.
Okay. No,
There's
thank
some
you.
sort of secret code going on here.
Yeah.
All right. Well, and you're satisfied that and Bayview did have a number of services which they've always been doing well. At times, the numbers of performance couldn't be carried out as well as we would like, and that's partly, of course, even at that time in the pandemic. Although it sounds like they've been also supporting a number of people in the community on the pandemic. Are you satisfied with the new, well, I call it new approach because we've had this problem with Bayview. And,
Yeah.
and I'm assuming that the reports here show that they seem to be really cooperating with the suggestions of the department. Would you say that's true?
Absolutely, yes.
Okay. And so, and of course, we'll be monitoring that as we continue to make sure that we will not end up with overloading them and not giving them a chance for success, right?
Right, absolutely.
Okay, that'll be fine then. And let's then proceed on to our next item.
Thank you, Dr. Chow. One thing I forgot to add regarding the Bayview is that there are ongoing monthly reports to provide continuing support and to follow up on issues as they evolve. So there are definitely regular ongoing communications and evaluations of their services and report issues.
Okay.
Just to remind you of that, put that on your radar.
And Dean, just for my record, is that the business office meeting or is it a combination of the business and SOC?
It's not a business office meeting. It's DPH leadership. It's some folks from the fiscal side, Drew and others.
Okay. Okay, great. Thank you.
Yeah. So Mark, is this one of the agencies that we said we wanted to get a follow-up report on?
Commissioner Chow, I don't remember, to be honest, but I will check in my notes and see.
why don't we take a look, because they do have a good number of programs, and if it isn't, it's probably one that would go along with what we had asked, I think the last time, for some of the big contractors to get, especially on the fiscal side, to be sure that we are monitoring them.
Yes, sir. I'll add this to the list.
Okay, thank you. Next then,
Next up is number 3, again, a PHFE doing business as Haluna Health. Approval of a contract amendment to increase the total contract amount to reflect $2,834,781 in a new contract term of August 1, 21 through June 30th, 2025 for 3 years and 11 months. Haluna Health provides program administration and management services for DPH, Population Health Division, Communicable Disease Prevention Units immunization program to continue to support COVID-19 and routine vaccinations. Of the proposed annual funding in the amount of $727,285, Haluna Health receives a 12.1% administrative fee of $78,503 annually, with the remaining balance of $648,782 going towards programmatic costs. The proposed new agreement exercises the authority under RFQ 3-2020, and funding will continue to provide support under the program administration modality. The increase of $804,089 is due to the following changes: state grant funding in the amount of $431,380 for fiscal year 24-25. State grant funding in the amount of $295,905 also for fiscal year 24-25. And an increase in the amount of $76,804 to the 12% contingency value applied for those 2 years, 23-24 and 24-25. Previously, the contingency amount was $48,991, and the new amount will be $125,795. The annual funding level decreased by $170,575 due to a decrease in the state grant of $145,474 in fiscal year 23-24. And 24-25, as well as a decrease in the amount of state grant funding of $25,101 to those same fiscal years for 23-24 and 24-25. We have David Steyer, the director of the Communicable Disease Prevention Unit, attending virtually if you have any programmatic questions for him.
okay, well, let me go to the funding change for a moment. And you're showing an R3 a state grant increase of 431,000, and then and then you show that they decreased the amount by 145,000 for the previous fiscal year. I mean, is there a reason the state is doing this, or the state's closing out and then they're giving you another funding for the following year? That's just an example of the R3s and the R4s, just trying to understand that. In one instance, they're then providing you additional funds, but then in your other sentence, they're taking it away.
Do we have
Yes.
David?
Hi, Commissioner. I'm sorry my cam is not on, but this is David Steer. I'm responding, and thank you for the question. So the state provided round 3 and round 4 funding as of 2 years ago, and the total amounts have not changed. We have simply shifted where the budget is coming from that existing funding.
Oh, okay. That's fine. And since we have had a reduction, there's somebody else speaking.
Please only speak if you're spoken to, everybody, just so we only have one person speaking at the meeting. Thanks. Go ahead, Dr. Chow.
Okay, thank you. I was just going to ask, with the reduction of a number of our services and points of service, is that what reflects the 170,000 decrease?
So we were able to not have to hire one of the existing 5 positions for the following fiscal year. So I think that's what's accounting for the change there.
Oh, okay. Fine, all right, then let's go on to our next item then. Thank you very much.
Of course. Item number 4 is with Positive Resource Center. This is a contract with HIV Health Services. Requested action approval of a contract amendment with PRC to increase total contract amount with contingency to $1,095,359. Current term is July 1, 23 through June 30th of 24 for 1 year and will remain the same. The contract was previously approved by the Health Commission on June 6th of 2023. This contract provides support for HIV employment and work reentry services. Proposed amendment exercises options authorized under Admin Code Chapter 2142. Funding will continue to support the non-medical case management modality. The increase of, the approval of a total contract amount with contingency of $1,095,359, or an increase of $165,252 due to the following. It's an increase in the cost of doing business with the general fund funding of fiscal year 23-24 in the amount of $37,546. And mayoral add back for fiscal year 23-24 in the amount of $85,000. A board of supervisors add back in 23-24 in the amount of $25,000, and an increase in the amount of $17,706 to the 12% contingency value applied for fiscal year 23-24. Previously, the contingency was $99,654, and currently it will become $117,360. Bless your Mark. And the annual funding level was increased in the amount of $147,546, as described for those 3 increases. We have Beth Neary, who is the Assistant Director of HIV Health Services, attending virtually to respond to any further questions you may have, Commissioner Chow.
Okay, no, I don't have any understanding the add back. So I guess the only point is that we're halfway through the year and now we're just getting to the add back. So that is sort of a significant block of time when these add backs were made. I would think that they were thinking it was going to be for the entire year. So it's only a matter of, I guess, efficiency that we are not getting to it until now. Would you, or it takes this long to put in the additional funding that might come in from a budget?
Beth, would you like to respond to Commissioner Chow's questions about the timing of the contract mod with the board add back and the mayoral add back amounts?
Yes, I'd be happy to. I have part of the information. The short information is that these add backs are expanding on programs that already were in contract, so they can spend for the beginning parts of the year. So they weren't given the highest priority. We didn't deprioritize them, but we weren't too worried about them running out of funding. There is one of the subcontracts, and a subcontract on there could be affected by the delay. But we were aware of that, and I think that they found ways to work with that person who was already an existing subcontractor to plan their work throughout the year. So it is unfortunate that it hasn't been quicker, but we don't think it will interrupt the work at all, and they should be able to expend the funds in this case for the year.
Okay, so you were aware of that and made sure that this wasn't going to create a hardship or a reduction of the reasons why the add backs are made, right?
Yes, and I remember now why there were delays. It had to do with finding the one where it was on the budget was a little hard to track down. The $25,000 was very clearly part of the DPH add backs, but the $85,000 that was on the mayoral's budget wasn't on that listed. So it took us a little while. It wasn't put with HIV Health Services, so we had to track the money down through going back through the budget. So it was a small administrative thing in the background, but on the front end, we managed it with the agency though.
Okay, as long as they weren't, getting shorted there. Thank you. All right, let's go on to the next one then.
Thank you, Beth. Item number 5, San Francisco Public Health Foundation, to approve a contract amendment with San Francisco Public Health Foundation to increase total contract amount with contingency to $6,187,809. Current contract term is January 1, 2018 through December 31st, 2025 for 8 years, and that will remain the same. Contract was previously approved by the Health Commission on March 7th of 2023. Contract will support project management of the San Francisco Health Network primary care services, which includes project management for behavioral health services. The proposed amendment exercises options authorized under RFQ 36-2017. Funding will continue to support the project fiscal management modality. The funding annual amount of fiscal year 23-24 is $943,600. The San Francisco Public Health Foundation will receive 10% indirect cost in the amount of $85,782. The remaining amount of $857,818 will be used for direct services. The total contract amount with contingency of $6,187,809 is an increase of $665,809 due to the following changes. Number one, additional funding for fiscal year 23-24 in the amount of $228,600. Additional funding in fiscal year 24-25 in the amount of $250,000. An increase in the amount of $187,209 to the 12% contingency value applied for fiscal years 23-24 through 25-26. Previously, contingency was $84,723, and the current contingency amount is $271,932. The annual funding level was increased by $228,600 due to a one-time additional state funding in the amount of $183,600 for fiscal year 23-24, and additional annual continuing project or ACP state funding in the amount of $45,000 also for fiscal year 23-24. I believe we have Carol Taniguchi, Deputy Director of DPH Primary Care, who's attending virtually, who can respond to any of your questions. Dr. Chow.
Thank you. So I think it's fairly clear, and so I think we can move on to the next one, and we can understand. I guess the only question I do have, can you think of it, is on the ACP state program. This assists both the network primary care and behavioral health services. Is that right?
It mostly mostly affects primary care. There is some behavioral health, and I think if you have specific questions about behavioral health part, I think we can certainly address that.
Okay, and as you are doing this, I guess I understand that this is where the incentive funds are coming from the state, and they're helping to provide it. But how does the Public Health Foundation actually see that we are then trying to meet their needs in terms of the I guess the scorecards they're supposed to have? Is that I assume that's what the ACP funding is?
Yeah, so we get incentive dollars through both the health plan and the state for clinical metrics. Most of them are primary care related, but there are some that are, that are hospital related or specialty service related. And based on how well we do on those metrics, we get what's, pay for performance dollars that come down to the network. And then we actually, in this instance, pass those through to the Public Health Foundation, and we're actually funding QI analysts for the clinics, and these are particular to the campus clinic, campus primary care clinics, to help us do like individualized outreach to the patients of these clinics.
Okay, all right, that's what I was trying to understand, was the services that were being rendered, but certainly it sounds that you all do a very good job. We seem to get very good dollars back from our program, so I really appreciate it. Let's go on to our next contract, please.
Great. Item number 6 is for Chinese Hospital. This requested action is a re-request of the approval of a contract amendment with Chinese Hospital with their revised budget. This is the second change to the original submission to correct a calculation error in the proposed funding level, as the original didn't fully cover current spending. The original Health Commission resolution was approved on November 7th, 2023. It was an increase of $8,896,000 for a total of $18,851,840 over the same period of December 1, 23 through November 30th of 24. Due to recalculation to address identified a potential underfunding, We are providing an amendment to the original resolution. The proposed not to exceed amount is now $20,638,800, which is an increase of $1,786,960 from the original request. The changes are also reflected in the budget and legislative analyst report recommendation sent to the Board of Supervisors. The contract was returned to the Health Commission to reconcile the total contract amounts with the new amount as it has evolved. This contract requires approval by the San Francisco Board of Supervisors. If you have any questions, I believe we have Kelly Hiramoto, Manager of Special Projects with the DPH Business Office.
No, this is very clear, so thank you very much.
Thank you. Thank you, Commissioner Chow. Item number 7, we're halfway through. Westside Community Mental Health Center. Requested action in the approval of the contract amount with Westside Community Mental Health to increase their total contract amount with contingency to reflect a new amount of $7,914,974. The existing term of March 1, 2020 through June 30th of 2024 for a total amount of 4.33 years will be extended to the term of ending on June 30th of 2028 for a total of 8.33 years, increasing the contract for 4 additional years. This contract was previously approved by the Health Commission on July 5th, 2022. Contract provides HIV-related support for home and community-based AIDS case management services and home health care for clients, mostly older clients and long-term survivors of HIV that are primarily homebound due to physical or mental health challenges. Proposed amendment is authorized under RFP 39-2019. Funding continues to support the home and community-based services and home health care modality. The requested approval amount of $7,914,974 is an increase of $3,886,343 due to the following changes: a cost of doing business to the general fund increase in the home health care portion of the contract, and the amount of $10,988 for fiscal year 23-24. Also a CODB and general fund for the other part of the contract for home and community-based services in the amount of $28,583 for fiscal year 23-24. Additional general fund funding for home health care in the amount of $2,521,348 for fiscal years 24-25 through 27-28, which comes out to $630,337 annually. And additional general funding for the home and community-based services in the amount of $969,276 for that same fiscal years 24-25 through 27-28, which comes out to $242,319 annually. A reduction of the Ending the HIV Epidemic program of the RN Mobile Blood Draw Project in the amount of $143,259 for fiscal year 23-24, as well as an increase in the amount of $499,407 applied to the 12% contingency value for future years. Previously, contingency amount was $27,996, and it will now be $527,403. The annual funding amount is decreased by $103,688 due to the following: as referenced, a decrease in the annual amount of $143,259 in the Ending the HIV Epidemic funded program for the RN Mobile Draw Project for fiscal year 23-24. Previously, annual amount was $175,000 and is being reduced to an annual amount of $143,259 to reflect the new funding amount for that year for fiscal year 23-24 of just $31,741 due to the project ending. Additionally, a cost of doing business in the general fund, home health care for $10,988 for 23-24, and another cost of doing business for home and community-based services in the amount of $28,583. Again, we have Beth Neary, Assistant Director of HIV Health Services, should you have any further questions.
No, this one also seems fairly clear, so we can go on to the next item, please.
Thank you, Commissioner Chow. Item number 8 is with RevSpring Incorporated. Requested action in the approval of a contract renewal with RevSpring Incorporated for a new contract amount of $3,766,697 and a term of August 26, 2023 through August 25, 2025. RevSpring to provide services and software to print, store, and mail patient statement mailers, insurance letters for the patients of Zuckerberg San Francisco General Hospital. The proposed annual funding in the amount of $672,624. Base services amount to approximately $508,923, inclusive of paper and postage, and optional services for items such as additional pages, return mail, and file management in the amount of approximately $163,702. Proposed new agreement exercises the authority under RFP SF Gov 8069 as RevSpring Incorporated was the highest ranked proposer in the response to the solicitation. The commission had reviewed and approved the contract under Apex Print Technology on March 6, 2018. On December 31st, 2019, Apex Print Technology was merged into and became a part of RevSpring Incorporated. The current RevSpring Incorporated contract is a result of a new solicitation under the solicitation referenced above of 8069 for continuation of these same services by the same provider, which was previously approved by the Health Commission. The contract is retroactive due to reorganization within the contractor's legal department. DPH provided contractor the city's boilerplate for review, and contractor was unable to turn around documents in a timely manner. After almost 2 months of review, a handful of contract negotiating meetings were conducted. Both parties finally reached an agreement at the end of December. Given the contractor's existing relationship with the DPH, they continue to provide services based on good faith to avoid a break in service for the hospital. The department is requesting an approval in the total amount of $3,766,697, inclusive of the increase of $403,575. Due to inflated postage fees from the Postal Service from 50 cents to 63 cents and inflated cost of paper and printing materials. If you have any questions, we have Tim Arnold, Director of Patient Financial Services, who should be attending virtually, who can respond.
No, thank you. This is very clear. I'm glad you actually spoke as to why it was retro. And we can move on to the next one, please.
Thank you. Number 9 is the first of 2 from the San Francisco Study Center. Requested action is the approval of a new agreement with the San Francisco Study Center, contract ID 29560, for a total contract amount with contingency of $3,302,073 for a contract term of January 1, 2024 through December 31st of 2027 for 4 years. While this is a new contract, it is for continued services previously approved at the September 1st, 2017 Health Commission under the previous contract ID of 8860. This new contract to continue these services was awarded as a result of sourcing event number 7727. The San Francisco Mental Health Clients Rights Advocates, acronym MHCRA, will advocate for the rights of mental health consumers throughout the behavioral health system and for their families. We'll also advocate for mental health consumers and family members in resolving complaints. They'll respond to complaints and queries about mental health services from clients, their family members, or concerned third parties. Please note that the prior annual amount with contingency is the annual amount of the specific program, which was the portion of the previously approved contract, which has been transitioned to this new contract for continuing the services and is provided for comparative purposes only. If you have any questions, we have Tracy Helton, who's a MHSA program manager who's attending virtually to respond. She's also prepared to respond to the questions submitted earlier, Dr. Chow, regarding the client cost of $8,000 and the 80 visits per client and how that success has been. Tracy, are you online and available to respond?
Yes. So I met with I virtually was going back and forth with the contractor. So the Mental Health Clients Rights Advocates is an unusual program because it is required by the state Medi-Cal plan that each county has a patient rights advocates organization that is funded by the plan. And so MOCR doesn't just meet with clients, they do some compliance-based work. So they review at least 4 behavioral health facilities for compliance with patient rights. They go into our locked facilities and other places and do patient rights checklists, and they also do 12 educational outreach activities around patient rights. But the main function of the Mental Health Clients Rights Advocates is to meet with folks that may be in acute facilities who either don't understand why they're on involuntary holds or perhaps want to leave against medical advice. So due to either the lack of capacity of the clients or the unclear communication. So clients aren't often aware of what they're doing in these situations. So there's not necessarily a clear, like, client story. It's an ongoing process of MACRA going out and educating the different people in these facilities about their rights. This might be an ongoing request from the same individual as they're going through the system. So they go to SROs, they go to locked facilities, they go to board and care facilities and community behavior mental health clinics, and they also do education with families.
Okay, so when you say there are 75 unduplicated clients, then actually, is it that over the year, that's who the advocates worked with, or and took care of their cases, or were there others also? I mean,
So
broader than what the 75 clients are listed as.
So the report from the agency is that there was 515 cases last year. They resolved between 500 and 600 cases per year. So those can be the same client with individual. So a client may have multiple cases about an individual facility, or as they're moving facilities, they may have multiple cases.
Okay, so this is where I guess our request fails, because the 75 clients, it sounds like they each had about 8 problems or something that had to be solved. So, but okay. Well, thank you for the explanation. That's very helpful. And if this is a state required program, we will need to comply. So we can move on to the next one, please.
Will do. Item number 10, also San Francisco Studies Center requested action and the approval of a new agreement with the Studies Center, contract ID 23219, for a total contract amount with contingency of $2,472,122 for a contract term of 1 year from January 1, 24 to 12/31/24. While this is a new contract, it is for continued services previously approved at the September 1st, 2017 Health Commission under contract ID 8860. This new contract is to continue these services as authorized under San Francisco Administrative Code 2142, while a new solicitation is being completed. San Francisco Studies Center will provide fiscal intermediary program management and culturally congruent and innovative practices for African American community services in support of developing a diverse and competent workforce, human resource management support, management consultants and subcontracts, and other administrative and financial support. Department is requesting approval of a new contract in the amount of $2,472,122, as I said, for the calendar year of 2024. We have Tracy Hilton available as well to answer questions about this contract, including the question you sent earlier, Dr. Chow, about the increase, why there's an increase of $808,000 if these are continuing services. FI work is about $869,265, and the cultural program is about $394,000. So Tracy, are you still available?
Yes. So most of the funds for that particular program are funded by state innovation dollars. So there was a slow ramp up to the programming. The program can last no longer than 5 years. So we now have expanded the program into various clinics. So there has been an increase in the budget, and there's a few more years left in this program.
Okay, so for the first several years, it was, as you say, a slow ramp up, and then now you're actually at where we should be at for a full use of the or full capacity. Is that what that is?
Yes. So right now, the implementation of the interventions has taken place in five of our DPH clinics.
Okay, because just adding across in the units of service annual, then that's historic rather than what we're really going to be looking at, right?
Yes, in addition, we also there's been a process for raising the salaries for the peer employees. So peers in our system have been historically underpaid. So we've tried to find additional funding to reduce, to increase those salaries closer to market level, so we can retain our employees.
Okay, well, very good. All right, no, that's helpful, and thank you very much.
Thank you, Tracy.
Okay.
Next item.
Yes.
Number 11 is Positive Resource Center. Requested action in the approval of an original contract with PRC for a total contract amount of $7,518,130 with a contingency of $811,503 for a term of January 1, 2024 through June 30th, 2027. The contract provides counseling, advocacy, and legal assistance to the uninsured, the underinsured, and people living with HIV to improve their eligibility and enrollment in healthcare and other public benefits. The new contract is authorized under sourcing event number 7335 for supplemental security income and benefits advocacy. These are continuing services with the same provider previously approved by the Health Commission on March 5th of 2019. Sorry, March 5th, 2019. Positive Resource Center previously provided the services as part of contract ID 3034, which was previously approved under Admin Code 2142, while the department developed the RFP that was just completed. The previous year annual amount is provided to annualize changes in funding. The variance of $76,259 from dollars from fiscal year 22-23 to 23-24 is due to the cost of doing business adjustments that have been applied to the contract. If you have any programmatic questions, we have Angelica Almeida, who's the Director of Adult and Older Adult System of Care within DPH, who's here available in the room. And we also have Beth Neary from HIV Health Services that is part of these services as well.
I guess according to the monitoring report, it shows that there seems to be fairly good contracted performance objectives, which is good. From the fiscal side, has there been a continued watching? I mean, I see the reports that go up until from our offices through what, I guess, looking here, where there were still some reports that were out of that weren't yet in compliance as of November 13th. So I'm just wondering if in the last 2 months there's been further information as to what's happening with the fiscal status of PRC in Baker Place.
I'll let Wasim Samira from the Business Office of Contract Compliance respond to that question. And also just remind you, Commissioner, this is one of the programs that you asked for a report back on in May or June. So we'll be coming back with an update on the items in this report later in the spring. But for your first question, I'll let Wasim respond.
All right. No, thank you. I just feel that we need to find that there's a continuation of our due diligence on PRC here.
Good evening. Good afternoon, sorry. The fiscal and compliance monitoring, we do it on an annual basis. However, with this agency, particularly, we are continuously meeting with them. So even though this report was as of, the final status was as of November, we have pretty much weekly meetings with them, with the BUCC, the fiscal person here at DPH, and also the system of care, to monitor them and, help them out with their contract restructuring and, following up on any issues. I did follow up with them that we will be waiting on the audited financial statements for March 31st. That's kind of the deadline for when they need to complete, and they're on track on doing that. So once we have that in hand, we'll do the full fiscal and compliance monitoring and have a new report.
Okay, very good. Just wanting to be sure that we're still right on top of them. Okay. Thank
Go ahead.
I don't have any other questions on that. Looking forward to them finally satisfying all the requirements that you have for financial stability. So
Thank you.
let's go on to the last contract. Thank you.
All righty. Item number 12 is with the YMCA. Requested action is a new agreement with the YMCA to implement the OMI Excelsior Beacon Center program in a separate contract dedicated to these services. This program will provide substance abuse and alcohol prevention services for elementary, middle school, and high school age students and their parents or caregivers. These services are authorized to continue as a new contract under Administrative Code Section 21.42 while the department develops a solicitation. The total contract amount with contingency requested is $1,093,393 with a term of July 1st, 2023 through June 30th, 2025 for a total of 2 years. The OMI Excelsior Beacon Center program services were previously provided under the YMCA of San Francisco Urban Services Contract ID 10841 with a term of July 1, 2018 through June 30th of 2027. It was last reviewed and approved by the Health Commission on December 4th, 2018. Reasons for the change: the previous year annual amount is provided to annualize the changes in funding. The annual contract amounts are almost identical with a variance of $1,017 from fiscal year 22-23 to fiscal year 23-24 due to a slightly less federal funding in that fiscal year 23-24, as well as a cost of doing business adjustment of 4.75 applied to the contract for that year. The comparative decrease of $8,894,210 in the total contract amount with contingency is due to the term of the following agreement being a total of 9 years, whereas the new contract replacing the former is only for 2 years. We have Rebecca Matthew, who's the DPH program manager with the Substance Use Disorder Services System of Care. She's attending virtually to respond to any other questions you may have. A question was submitted earlier regarding the YMCA evaluation requiring a corrective action plan, and you asked if that has been monitored. There were 2 areas within the plan of action. The response, first one was regarding program compliance. No response received for the program for the request of attestation to the compliance of the funding policies and procedural requirements. And there was a request for the program to submit a plan of action detailing how the program would ensure compliance with these. And the second part of this plan of action was that there was no response received from the program for data requested for 29% of their total objectives. And the plan of action was asked to require the detailing of how the program would comply with data requests for future accurate program monitoring. The agency did respond, the YMCA did respond and forwarded that they will have duplicate files online as well as physically on campus in order to prevent a future situation where they cannot access files at the site where the staff are participating in the annual review. Staff have access to USBs and work computers in order to keep the information confidential as well. And with that, if you have any further questions, we have Rebecca Matthew to respond in more detail.
Okay, I guess the question that I would have is, if we had a contract that went on to 2027, why are we separating out this particular part of the of the main contract?
I believe it's the 2142 solicitation had the time limit had ended, so we are extending it for an additional amount of time while we complete the solicitation. But I could double check that and respond further, unless you know offhand, Rebecca.
Hi, this is Rebecca. I'm the SUD program manager. The reason why I can explain that the solicitation hasn't come out yet because it has to align with the new State of California Prevention Strategic Plan, and they're delayed in publishing it. And so the contract office has graciously given us a 2-year solicitation extension, sort of bridge the gap until the solicitation can be published. The reason they separated, I believe, is just for business purposes because they were otherwise combined with other RFPs and multiple RFPs in one contract ID, and it was just wanting a clear direction for each contract that has separate RFPs. They just separated them. A business decision that's outside of SOC. Yeah.
Okay, we keep going back and forth about whether or not we're going to combine these all into large contracts or separate them out. But this one I understand. We're extending a service we need, and we are then extending this contract while waiting for us to develop the RFP for it from state requirements, right?
That's correct.
Very good, and it's really a needed service, which I'm very pleased that we are actually doing in all these schools. So, great job, and we'll then move on to the new contracts.
Great. Thank you, Commissioner.
Thank you, Dean, and everyone who participated. Item 4 is the request for approval of a professional services agreement with Felton Institute.
Morning. If I knew what time of day it was, good afternoon, Commissioner. I'm Angelica Almeida. I'm the Director of the Adult and Older Adult System of Care for Behavioral Health Services, and here to speak about this new solicitation for Felton Institute. So as was noted, this is a new solicitation, but it's expanding our existing intensive case management portfolio to serve an additional 50 individuals. This is new funding that's being added to our system. So represents a huge increase in services that we're very excited about. This solicitation is focused on older adults. As we know, older adults represent our most increasing population in the community. A point in time reference for our adult civil service clinics, roughly 40% of the individuals we are serving represent an older adult population. So while our entire system of care needs to increase capacity and competency around serving older adults, we want to ensure that our system has dedicated and intensive services for individuals who have more specialized older adult needs, including neurodegenerative disorders, in conjunction with serious mental illness. Excuse me. So Felton Institute serves older adults currently in intensive case management and full service partnerships. Because this is a new solicitation, it'll be a standalone contract, but they're building off of their existing services and competency in this area. And so as we are working on adding this funding into our system of care, this initial phase for their contract is startup funding, including hiring a recruiter to support hiring the specialized content expertise needed for the population. Commissioner, also in response to your question regarding the units and the rates of the units, want to just add that this is also in the context of contract shifting to cost reimbursement with the CALAIM changes and documentation and billing reform. Including that our intensive case management programs are not able to bill for field-based, for travel time or documentation time. And so that gets rolled up into a higher unit rate. However, this team will have enhanced opportunities to engage people in the community, particularly individuals who might not be as engaged or struggle with that. And in addition to that, they will be providing 24/7 coverage. Of course, I'm happy to answer any questions that you have, but again, this represents a huge benefit and increase to our system and adding capacity to intensive case management services. And we're very excited to continue partnering with Felton Institute around this.
Okay, so just let me understand then that you're saying that the doubling of the unit cost is actually related to the fact that you now are actually adding more items that they are doing Is that right? Because it goes from 823 a unit to 1,647.
And I think there might have been a typo in that actually when I was looking at it earlier for the ongoing services. So it's higher for this initial ramp up period with the recruiter and other ramp up costs, but the 823 will remain constant.
So the 823 remains constant, but then it says 50. When you get to 50, then you're at 1,647.
That's a typo that needs our correction. I apologize for that.
Okay. So you're saying that's really still 823.
Correct.
All right. That's much better. Thank you.
Yes, and I apologize to Dean. I caught that on my way over. So
Yeah. No, that's helpful. And of course, these services are important. Would you comment, if you can, on any of the allegations that's been in the public in regards to the employee treatment by Felton?
well, I'll just say that we certainly have, of course, been informed, as have many departments, as Felton works across our city and across departments. And so we take these allegations and concerns very seriously. We're coordinating with other departments to make sure that we have a coordinated response in investigating these claims and gathering additional information. I don't have updated information to share, but Felton Institute as an organization is in good standing with us as a contractor based off of their program and contract monitoring. But this is something that we'll need to continue to have oversight over in partnership with other city departments.
Okay. All right. I think that would be that'd be very helpful to be sure that we're having the employees treated appropriately.
Absolutely.
Yeah. Okay.
And if I may, Dr. Almeida and Commissioner Chow, when I spoke to the city attorney about this a few weeks ago, she said that I believe the DPH and possibly the city attorney's office is doing an audit to ensure that no funds that go through the city are being spent on quote unquote union busting activities. So that's part of, I think, the investigation happening. I don't think that's completed yet. I think you all will hear once that's done.
Okay, very good. Yeah, just keep us updated, and certainly the services are needed. So we just want to make sure they're given and that the people who are performing them get paid. So
absolutely. Thank you.
Thank you. We'll go on to the next contract.
I'm sorry, yes, I had a text from a commissioner. I was trying to make sure. Item 5 is request for approval of new professional services agreement with ProLink Healthcare.
Hi, I'm Nita Rotana-Wongza. I'm the interim CMO for Laguna Honda Hospital as well as for San Francisco Health Network. This contract is related to an RFP for another contract we had approved previously. This is to provide respiratory care services to Laguna Honda Hospital in the evenings, including weekdays and weekends, to ensure we have 24/7 respiratory care services. We currently have hired respiratory care practitioners who are available on call to come in, but to meet our acute care compliance needs to provide adequate respiratory care services, we want to make sure that we have 24/7 in-house respiratory therapy. And this registry will help us to get there until we can bring on additional staff to be able to do this through DPH employees.
Okay, so how much? I guess this is as you may need, right? So I know that way in the past, respiratory problems were sort of looked on as being outside of the purview. So would this be not only on the acute ward, but is it also in our SNF area that you might be able to maintain somebody with some respiratory needs within house without sending them into an acute facility? Would that be also how this would be used?
Yes, exactly. We have respiratory care services for 7 days a week during the daytime right now, and then on call. But as you know, to be coming from home to provide respiratory care services is not as ideal. And this will allow us to maximize the use of that acute care unit, but also to prevent transfers from the skilled nursing facility should they be able to stabilize and stay in the skilled nursing facility side.
Great. No, I think that's fine. And I don't have any other questions. I think it's a service needed for some time. So.
Great. Thank you, Dr. Chow.
Thank you. We can move on to item 6, request for approval of a new contract for after-hours telephone answering services with AnswerNet.
Good afternoon, Commissioner Shaw. My name is Colin Hart. I'm the Director of Operations for Primary Care, representing this solicitation that is going to be servicing our patients during the after hours when our DPH business offices are closed. This contract serves 5 programs across 3 sections across DPH. This is an existing service that we have here in our system of care, but we are soliciting for a new vendor as where we have been engaged with AnswerNet. As part of this solicitation, we have, in good faith, AnswerNet has begun working with us in order to onboard all 5 of our programs to help with the onboarding and to learn the both the individual clinics and the program's scope of work, services, and operations. Moving forward, as part of the evaluation and continuous quality improvement of our contract, we are going to be working in quarterly business reviews with AnswerNet to review the metrics as listed on Commissioner's memo to ensure that the services rendered are both up to the quality that DPH expects. David Evangelist is actually on the call representing the vendor who have been in close contact with DPH since about mid-December, and he can offer anything that he may provide value to this solicitation.
So have we do have an answering service right now, and
We do.
And this replaces it.
We do have an answering service that this replaces it. This answering service is required by our state regulators and as required by medical ethics to ensure that we have our patients who have medical questions to be responded to in a specific time frame. So this is just a new contractor for an existing service that we already have in our system.
Okay, and this is not a nurse advice line then?
This is not a nurse advice line. This is simply to take messages and then page on-call providers, those staffed through DPH, in order to triage medical questions.
Okay, all right, and I mean, it's quite a challenge to understand how each of these sections operate, right? I mean, you have
Quite the challenge. So we actually meet as part of our ongoing relationship. We meet with AnswerNet weekly for recalibration calls. So essentially what we had set up with the contract and then calibrating it weekly and to ensure that the operations are running smoothly. And then dovetailing into that will be the quarterly business reviews. So we will identify the metrics and then review those ongoing.
okay. And do you have an idea of the volume of calls that you would get of this nature?
It's a great question. We did a 6-month review. David, you might remember this number. At the top of my head, I believe in the 6-month review, we had about 15,000 calls that came through in the after hours. And then this also, Commissioner Chow, includes during business hours where we are unable to get to the phone and or during planned shutdowns, staff retreats, and just when we aren't able to meet the public's need for the answering service.
Sure. Do we have a separate nurse advice line?
For primary care, we do have a separate nurse advice line that's staffed by staff nurses. And that operates through the centralized call center with the San Francisco Health Network Primary Care. They offer services Monday through Saturday. That also reflects the centralized call center hours. So this essentially is a service that kind of helps, instead of the nurse advice line, the providers after hours serves as that medical advice.
Okay, so it's sort of an old-fashioned system that we're using. The on-call personnel would answer the question, not the answering service or nurse advice line during the after hour.
That's right. Old school as much as we, in the old fashioned, as much as we still are using the pagers to reach our providers in the after hours.
Okay, all right. It's interesting. On the primary care side, then, we don't offer a 24-hour nurse advice line then?
No, we don't.
So maybe we should look into something like that, in the sense that certainly all the commercial plans do. And
Yeah, and I think given our staffing restrictions within DPH, this service offers the connection to then put patients in touch with a medical provider 24/7. So I think this is the stopgap to ensure our state mandated regulations that we have to provide a screening and triage within 30 minutes for all San Francisco Health Network patients. And this 24/7. So this actually serves as the stopgap when the nurse advice line and the centralized call center is closed.
okay, well, we of course need to have it. Just thinking we might move into the 21st century, that's all.
Exactly, yep.
Okay, thank you. No other questions on this. Let's just move on to our next contract.
Thanks again. Item 7 is a request for approval of a new grant agreement with Richmond Area Multi-Services to provide culturally appropriate, equity-based maternal health. Ms. Brown is back.
Sorry. Okay, sorry about that. We had a presentation, so I just wanted to make sure that was available. Just a moment. So hi, I'm Jessica Brown. I'm the Director of the Office of Justice, Equity, Diversity, Inclusion, and the Mental Health Services Act. And this is for a new solicitation for equity-based mental health services, particularly pertaining to Black African American birthing people. We have a new contract with RAMS and 3 other CBOs, Homeless Children Network, Rafiki, and also UCSF Embrace, to provide culturally congruent mental health services for birthing people pre and postpartum. This new solicitation is to really address the needs for birthing people to have access to mental health services, to reduce the rates of postpartum depression, suicide ideation, and also to any postpartum experiences from Black African American birthing people. And so this contract allocates $6 million over the course of 5 years, $1.5 million for each of those CBOs, Rafiki, RAMS, UCSF, and Homeless Children's Network, to provide culturally responsive services for birthing people. And this is all under the Mental Health Services Act. Very, very quick.
You're saying that UCSF is part of this contract, or?
Yeah, UCSF, their Embrace program. They're a program that was established a while back to provide birthing people with mental health services. So this program, under this new solicitation, would help expand the efforts of that program to provide it at different sites within San Francisco.
Okay. In your write-up, UCSF is actually not mentioned. How do they work with RAMS on this?
Yeah, so the write-up just has the focus on RAMS, but the overall solicitation, it was awarded to 4 CBOs. So RAMS is one of those CBOs alongside of UCSF. They all individually received a contract with DPH to provide the mental health services. And again, that's going to be $1.5 million for each of those CBOs to provide culturally responsive mental health services for birthing people.
Jessica, I believe Dr. Chow might be asking also, is the UCSF part of the Rams contract, or is it it's part of the solicitation? Could you clarify?
It's a part of the larger solicitation. So with the larger solicitation, we awarded 4 CBOs with this contract that Rams is also under.
Oh, okay, so this one
Yeah.
is only the Rams part of the contract. I mean, the overall services, the services are being rendered by UCSF and Rams.
Exactly, yes.
Okay, and this is the Rams portion, and we would expect to see a UCSF portion.
Right.
Okay, and you're saying that it's 1.5 million per year?
Yes.
But
So
not for the,
that's not what it says here. It says all ongoing years is 6,963,000.
Yeah, that's the total for the entire solicitation. So under the one large solicitation, we awarded 4 CBOs with $1.5 million each to provide culturally congruent mental health services for birthing people. So under the Mental Health Services Act, we had allocated, set aside $6 million to select 4 different CBOs to basically have their own individual contracts with DPH under this umbrella of services.
Okay, so I think it may be Mark, that we're having a problem in reading this, right? Because the total is under the funding sources rather than the specific amount that that Rams gets.
Yeah, and I do have a large presentation that we can look at if you would like to see that, which kind of gives the scope, of the entire work.
Well, I'm actually just looking to find out how much we actually are granting Rams in
$1.5
this
million.
contract. Okay, and it doesn't say that here.
Okay, we could correct that to give you the exact amount that Rams will be receiving, but it's $1.5 million per year.
do you have the document?
Right.
Yes.
Yeah, we need to rewrite this, I think, because it talks about the total proposed agreement amount, and yet the vendor is Rams, and so this should also be only specific to Rams.
Yes, so this contract is showing just Rams. If you see that the initial year is $1 million for the first 6 months, then
Yeah.
ongoing will be 1.5, which gives you the total amount of 7.93, $7,963 million.
So, there's not going to be a quorum, you know how there's not a quorum at this meeting, there's not going to be a quorum at the full commission because this won't be voted on until February 6th.
Okay.
So maybe between now and then we can correct the document because the commissioners have to look at and approve the concrete contract document.
So are you just needing to see what they'll get each year? Because I believe the document is showing what they're going to be getting per year.
Yeah, I think why don't we just straighten this document out so
Okay.
that we understand exactly how much is being given to Rams, and maybe we're not quite understanding totally, but it does say that the total amount is 8.9 million, and I'm sure it's it's a good program, but our problem is trying to see what we are then contracting for Rams for.
And Ms. Brown, we can schedule the presentation that didn't happen at the last meeting at the February 6th meeting so that it might have context, because I'm hearing you that there's context and
There is,
and
yeah.
the commissioner's not getting
In that
context.
presentation, yeah. I thought I was going to be doing that today, but that's fine. We can do February 6th. That sounds great.
All right, so Commissioner Chow, I'll note that you'll get more information to clarify this through that presentation, and also possibly corrected, we're not quite sure if corrected document, and then we'll work with everyone on our end since it's not going to be voted on until February 6th.
Right, yeah, that would be helpful, because then I think we need to be clear about what certainly the services we understand. I think we're just trying to understand how this is being proportioned amongst all of your providers, and specifically Rams, which is the only contract we're looking at right here.
Yes, and this is coming from a pilot project that we did with RAMS and Rafiki and UCSF under the Mega Block dollars that were allocated from the Board of Supervisors to the Human Rights Commission. Community members asked for projects that would focus on maternal and mental health services. And this was one of our pilot projects where we allocated add back money. And then we were able to use MHSA dollars to actually make it a full term, longer term sustainable project.
Well, that's why I think the presentation would be very interesting if in
Yeah.
fact you're able to show that as a pilot. And like I said, specifically here, when we're passing some for RAMs, we want to know exactly how much we're giving them.
Right.
Okay.
Okay.
Thank you very much.
Thank you.
Thank you, and sorry for the confusion about everything. All right, item 8 is request for approval of a new professional services agreement with, again, RAMS. And Ms. Getta can explain.
Good morning, or no, it's afternoon. Good afternoon, Commissioner. My name is Krista Gata. I'm the Director of Strategic Initiatives for our Population Behavioral Health Division of BHS. I'm here to present a new contract for RAMS Peer Services on the Street Crisis Response Team. This contract is a result of a solicitation for peer services and replaces a previous sole source contract with RAMS presented here in April of 2021 when the SCRT program was implemented. The Street Crisis Response Team is part of the Mental Health San Francisco legislation and is in collaboration between the Department of Public Health, the Fire Department, and the Department of Emergency Management. Street Crisis Response Team provides crisis response for individuals as an alternative to law enforcement and responds to calls triaged by the Department of Emergency Management's 911 system for nonviolent behavioral health crisis in San Francisco. The program operates 7 days a week, 24 hours a day. This contract is just for the peers who are embedded in the Street Crisis Response Team. They are a critical part of the SCRT team, which are currently made up of a peer counselor from RAMS, a fire department, EMT, and community paramedic. Daily management of the SCRT rigs is done by the fire department, with DPH managing the contract for RAMS peer services on the rigs, as well as managing services that provide follow-up after the street crisis team has a contact. The role of the peer within the team is crucial to crisis de-escalation in a trauma-informed way, complementing the skill set and scope of the EMTs and paramedics on the rigs. RAMS uses motivational interviewing, harm reduction, and culturally responsive interventions to work with a very vulnerable and oftentimes unhoused population. The hours RAMS is contracted for allows RAMS to staff 6 street crisis vans 24/7 with capacity to extend to 7 vans. Staffing is set to 15 full-time peer counselors and 3 supervisors. The target population for this contract is people for whom a 911 call is initiated and who are found via OnView, so when they're just driving around, to be in need of crisis, de-escalation, or wellness check. Performance of this contract is reported monthly via a public street crisis response team dashboard. So since it's a team response, we evaluate the performance based on the whole program. So we look at call volume, the timeliness of the response, our client demographics, and the disposition or interventions of the call. Since SCRT launched in November 2020, they have responded to over 26,000 calls, and they currently respond to over 1,000 calls a month. This contract date for this contract run from January 1st to December 31st, 26. And the funding amount for the first 6 months is $2,823,900. I'm also joined here by my RAMS colleagues, Richie Zevin and Angela Tang, if you have some other questions.
So, total number of people that are hired under this for the crisis vans or what?
So for this particular contract, so it's just the peer. I'm getting some.
Hold on.
Okay, thanks. There are 15 full-time peer counselors and 3 peer supervisors. So there's 18 total staff.
Oh, okay. I see. Okay. And 3 supervisors. Okay. All right. Okay, well, I think we've certainly heard of all the work that's going on out there on the streets with this, and this is one of the elements for doing that. So I don't have any more questions in that. It's part of that street crisis response team, right? And I do refer back, and Mark, maybe we can take care of this again under the the previous contract, because under the primary target population, which also confused me at that time, they're talking about what it sounds like is that these are the peer counselors, and yet it's written under the first contract for Rams.
Commissioner, I'm not sure. You're talking about the client target for the previous item?
Yeah.
Okay.
Yeah, I see where you're pointing that out, and that's been a historical part of this contract, is to not name the actual clients for which we'll be serving, but a real focus on the peers as the target audience. So is what you're saying you would like to see that further defined as who will this intervention?
No, I don't need further.
Oh, okay.
I'm saying that the previous contract, which had to do with maternal health,
Uh-huh.
it's about the purpose of the contract is to train peer counselors, so that it's in the wrong section, it seems to me.
We'll work on that, on both, on that contract to make sure it matches. I'm not,
Yeah, take a look at it. It's under primary target population, which of course is then homelessness and so forth. So I think there's a mix-up here.
okay.
I believe that the second contract is quite clear about where you're trying to go, and I think that that is part of the confusion when you're reading these two.
Yes, sir. I will, I'll talk to Mr. Goodwin about that after the meeting.
Okay. And so the second contract, I think we all understand the programs, and it's wonderful to see that it is continuing, and that we have 15 full-time peer counselors out there on the street. So thank you very much.
Thank you.
I don't have any other questions on that one.
All right. Thank you very much. Happy New Year. And since this is an information session, we did not do any other items. We're done with the information, the discussion of the information. Commissioner Chow, thank you again so much. And anyone who helped today, thank you for your support. And that's it. Thanks.
Right. And I would also like to give my thanks for all those who were able to come. I'm sorry I was not there, but am really pleased for the presentations and the fact that staff was available to help respond to the questions. So until our next meeting, thank you very much.
All right. Thanks, Dr. Chow. I'll see you soon.
Yes.